Hello everyone. For those who have joined for this session on how to prepare for NEET SS. For those who do not know me, I'm Dr. Riddhi, critical care faculty for Marrow. And just a bit about myself before we begin the discussion. So I basically did my MD in anesthesia from All India Institute of Medical Sciences in Delhi. And then I did my DM from the same institute. So I finished my DM in 2018. After that, I also completed my European Diploma in Intensive Care and then subsequently did a fellowship in Critical Care Medicine from University of Toronto. So currently I'm working as a consultant in critical care. So we are here to basically discuss a bit about the changed regulations in terms of NEET SS that was recently published and what it leaves us or how we actually or incorporate some of those changes when we're preparing for to get a specialty of our choice, or for those who want to basically do a super specialty or a subspecialty in critical care, right? As you would be knowing that we had this notification in October in which we kind of reverted back to what the previous settings was, that previously people who would aspire to do any subspecialty fellowship or super specialty, as you say, in critical care, they would have to basically take an exam where all the questions would be from critical care medicine. But unfortunately, in between, the National Board of Examinations kind of changed the course, and they suggested that all the questions should be coming from the medicine group, since critical care medicine was a part of medicine. But fortunately, and thankfully, they've actually changed that thing now, and they've kind of gone back to the previous settings, and which makes more sense, to be honest with you, because like for people who are trying to specialize in critical care, it really doesn't make any sense for them to actually answer questions from rheumatology, immunology, or so on. So it is kind of reverting back to the previous settings, and basically what we are now going to do is basically all the people who are going to appear for the exam, they're going to basically answer all the questions from critical care medicine. So it's kind of going back to the INISS or the previous NEET SS settings. So essentially, all the questions now will be from core critical care. There will be no questions from medicine, no questions from any other specialty. That obviously that kind of makes things a bit more streamlined. So anyways, this is kind of a welcome change. So in terms of eligibility, I know most of the anesthesia graduates, medicine graduates, chest medicine, respiratory medicine, as well as the emergency medicine graduates, they are kind of eligible for this exam, right? This is something that we usually would be knowing at this stage for those who are seriously preparing for the critical care as a specialty. So the essential question that comes is that why should we choose Marrow? All right. So obviously, I have my own conflict of interest because I have been associated with Marrow for more than like close to 2 years now. But essentially, what Marrow will provide you with is that it will provide you with about access to 75 plus hours of critical care lectures of mine, and this will be along with the notes that you will find at the bottom of every lecture. They will be taking monthly mock tests. They have a critical care question bank, which already has close to about 1,000 questions, and which they are kind of developing more and more questions with passage of time. And along with that, the biggest advantage, apart from the fact that it's very critical care focused, is the fact that you also get access to other lectures of medicine and allied specialties. So that I feel is a big plus, because sometimes what happens is that suppose you want to know about a particular topic in detail, and maybe you want to listen to arrhythmias from cardiology faculty as well. You can just go ahead and just watch some of those lectures as well if you want a more detailed thing. But otherwise, usually my lectures, whatever lectures that I provide for critical care, would suffice for your Marrow exam, for your critical care NEET SS as well as for your INISS. But obviously, it gives you more more freedom to explore other things as well. For example, you can access the biostatistics lecture for people who want to gain some more in-depth knowledge about statistics and so on. And that is just one of the big advantages of like subscribing to a platform like Marrow. And obviously we have the Marrow app. I don't know if all of you are subscribers or not, but if you have the Marrow app, it's very easy to access. It can be downloaded from the App Store or the Play Store, and then you can just go into one of the apps. And if you see those apps, like this one is from the question bank, and you can just go in there and you can just select the particular specialty that you want. And in the specialty of critical care, you'll get access to all my videos, which you can basically pause, watch. You can watch it at a 2x speed or a faster speed. You can make notes. Even the notes are available at the bottom of the screen. So it kind of gives you a lot of flexibility in terms of your preparation. And along with that, you also have the access to the question bank, right? So that is also there. So even if you want to kind of like access the question bank as well, you can get access to the question bank as well. And from there, you can just go ahead and solve questions of a particular specialty. In critical care, you can kind of go and choose a particular system which you have studied, and maybe you want to solve the questions from that specialty. And in addition to that, obviously, you'll have monthly mock tests that Marrow will provide you, which you can actually attempt to gauge your level of preparation. So that is all about what Marrow is going to provide you if you are a Marrow subscriber. And I generally feel that this is usually going to suffice more than enough material for you to actually clear. If you have prepared seriously, it will be enough for you for NEET SS as well as for INISS. So that goes without saying. So basically, I've tried to cover all the aspects of critical care in my Marrow lectures. There might be some more lectures that might be coming up in the next few months, but we have basically kind of covered all the major domains from respiratory, cardiovascular, nephro, neuro, GI, miscellaneous topics, trauma, as well as acid-base balances, infections, and all those things. And we are very open to suggestions as well. So if you feel that there's something which has not been covered, then you can just ping me, or you can ping Dr. Yogesh or the Marrow team, anybody, and usually they will be conveying me the whatever your messages, and then I'll usually try to cover those in my lectures as well. So it's obviously most of the things you would find already that is there. So that wouldn't really be a major sort of an issue. So as a critical care faculty, often I get pinged by a lot of aspirants regarding which textbook should I choose, right? So that is a very valid question, right? When you're preparing for exam, you usually would want to kind of go and study some sort of a textbook. So in those cases, well, there are a lot of options. Firstly, so you have to take your pick. Whatever kind of suits your reading style, whatever you are happy with reading is fine. You can choose between O's manual. There's this Fink's textbook, which comes to like Jolly Vincent, and Fink's textbook is there. Oxford textbook of critical care is also again a very comprehensive kind of a critical care textbook. There is Arvind Rippe. I wouldn't suggest that you study Arvind Rippe because it is too extensive. Maybe when you actually do your critical care residency, for that it's a good thing, but for aspirants, if you're trying to finish Arvind Rippe, you're probably going to land up in a soup. So I wouldn't suggest Arvind Rippe, though it's a very good textbook, but it's kind of very extensive. The Washington Manual, again, I would always suggest it's not a textbook per se, but it's also a very good resource to revise. Suppose you want to revise things before, like do a quick revision, maybe 10 days, 15 days before an exam. It's a very abridged kind of a version of a textbook. So that is something that you should always have, and something that you should always keep. Even if you're a Marrow subscriber, you should always have that, because that kind of gives you an overview of everything. It's not a very deep reading, in-depth reading, but it is still it carries a lot of information. So these are the things that you can depend on. Even if you're not willing to read any textbook, if you're just depending on Marrow notes and Marrow lectures, even that would suffice. But since a lot of people ask me because they also want to kind of consult a textbook, these are the options. Arvind Rippe, personally, I wouldn't suggest. But again, you have to take your pick, basically. When I was preparing, but that was back quite a while back. At that time, we also had those, and even now there is the PACT modules, which are basically the European Society of Intensive Care Medicine modules, which are also very good for reading. So if you have that kind of time to invest, then you can consider that as well. In terms of other resources, like some of the resources are free, things like Deranged Physiology, which is basically a website run by the Australian Critical Care Society. Kind of very nice illustrations there as well. We all of us probably know about Life in the Fast Lane or MCRIT, which are like free access resources over the internet. So suppose you just want to know about a particular topic and you just want to dial in, then they'll usually give you some nice explanation, some concept-based explanation of these things, and usually that would suffice for that time. Bottom Line is a great resource for trials. If you're somebody who is interested in trials and who probably doesn't have that good knowledge about trials, Bottom Line is a free to access resource. Obviously, you have UpToDate and Medscape. Medscape is free. You just need a login ID and a password. UpToDate, on the other hand, is a paid resource. Obviously, if you are willing to buy it, then you can go ahead. But otherwise, if you have an institutional access or your hospital has an institutional access, there is also a very good resource and something that most of us as clinicians usually use on a day-to-day basis for practice. But again, if you do not have access to UpToDate, it doesn't really matter, because the rest of the resources that I told you, the free to use resources as well as the Marrow lectures, would anyways cover whatever you need for the exam. But these are some things that can be considered. Radiology masterclass, especially if you're looking at X-rays, because I recently got asked, somebody was asking me about where to study X-rays. So X-rays, nobody will teach you, right? And usually X-rays are basically stored back in medical school, but at this stage, nobody will teach you how to read and interpret an X-ray. But this website, it's a beautiful website. It's a free website. You can just type in Radiology Masterclass in Google, and you can just see all the illustrations of X-rays. They cover almost all the pathologies as well as the normal anatomy and how to read an X-ray. It's a beautiful illustration, so something that you can consider, and it's very easy to interpret and very easy to understand as well. So very nice illustrations in that website. So these are all the things that other resources that you can consider in part of your preparation, even if you're currently doing a residency, even if you've already cleared Marrow and you're doing a residency. Even in those cases, these resources are very nice. Like even during my residency, I used to access some of these resources, and something I can definitely recommend you. Again, people ask me about what are the MCQ books or what are the MCQ resources. Obviously, the Marrow question bank, which obviously, as I told you, and plus the mock tests as well, right? So monthly mock tests plus the Marrow question bank are something that you can consider, especially if you have completed, suppose, one particular system. You can just go back and see that particular question bank or the section of that particular section, and you can try to solve some of those MCQs. There are a few other MCQ books as well that are available in the market, also in the Google Play Store. You might even get free PDFs from the internet, like Bennington, Lobas, and these are the ones that have been there for quite a long time now. Even when I was preparing, we would be doing some MCQs. There's this Oskies in Intensive Care Medicine by I think an author. I don't remember the name of the author, but these are some of the other resources, and maybe you would have access to other MCQ books as well, which you can use from time to time, basically to test your knowledge and test your application skills, right? So just doing theory or just doing or reading notes or just viewing the lectures is never enough for a competitive exam. For a competitive exam, you need to know how to apply your knowledge as well. So on one side, you need to watch the lectures, you need to read the notes or make your own notes preferably. And along with that, what you need to do is that you need to read the or rather solve the MCQs as well. For those who have questions, I'll take all the questions in the end. Maybe you can type it in the chat box for now, right? In terms of how to prepare, what I would suggest is that you should always try to keep it simple. Don't try to complicate things. Don't try to depend on 5 resources, and don't try to confuse yourselves, because that will just leave you confused over there. Over the years, what I have realized is that through all the entrance exams that I've gone myself, is that the simpler you keep it, the better your chances are. And the most important part is to revise, right? So what you should do, what I would do if I was a candidate, is that I would watch the videos, I would make my own notes. The notes, Marrow also provides the note, but if you have time in your hands, because writing is a very good reinforcement for the brain. So if you're able to do it, make your own notes. If not, just depend on the Marrow notes. So if you're possible, make your own notes from whatever you're studying. Even if you're not studying Marrow, if you're studying something from some particular textbook, just try to make your own notes when you're studying a particular topic. After that, what you do is that you try to solve MCQs from that particular section, or at least you should do some MCQs parallelly as soon as, and especially once you have covered a significant amount of critical care, once your knowledge is there, it would be easier for you to solve some of those MCQs, right? Again, from MCQs, you can make, from the explanation part of the MCQs, you can make your own notes, right? So these notes, they'll be very useful as revision resources 1 week prior to the exam. What happens is that 1 week prior to the exam, we do not know, we cannot probably end up revising or watching all the videos again, right? So during that time, what is very useful is to basically revise just the notes. And if those notes are handwritten, if they're written by yourself, then it also gives you a lot of confidence. And the basic principle of any of these MCQs exams, there's no secret to success. The basic success or the basic secret to success is basically to revise. Whatever you have read, you have to consolidate it. If you keep on reading till the day of the exam, something from new sources, most of the times what happens is that you do not remember and you are not able to apply that knowledge. So what is important is to consolidate what you have read. So every day, whatever, suppose you are studying for maybe, I don't know, whatever time after doing your work, you're getting 3 or 4 hours to study or whatever amount. So use the part of it to study a new thing, or view a video, make a new note, or use whatever the Marrow notes is providing you. And along with that, try to solve some MCQs and keep some time for revision. Once you have covered maybe 50 to 60% of your topics, then keep some time for revision. And that's why I say that Washington Manual is a great resource to revise as well. So these are some of the things that I feel, if you do it properly in a systematic way, the chances of you actually succeeding in this exam is going to be quite high. So right now, what the National Board of Exams has done is that because of the nature of the exam, because that they were not finding enough candidates, they've kind of lowered the percentile to 0, right? And we all know that for all specialties. So it is not about getting a seat. If you write the exam, probably you're going to get the seat somewhere, right? The point is to get a seat at a good institute, at a place where you actually, the residency is worth it. So for that, you need to get a better rank, right? And for that, definitely, if you prepare it in this fashion, if you take a systematic approach to your preparation, the chances of you getting a good rank would be much higher, and probably you'll be getting a good seat in an institute of your choice, right? So be it INI SS, be it NEET SS, the basic principles are still the same. And for now, given that the nature of the exam has changed, And now that they've said that the entire question bank or the entire questions are going to be from core critical care. So I feel this kind of nullifies or makes everybody or keeps everybody on equal pedestal. And that is something that you should take it as an opportunity. And obviously you should use this, the Marrow, as a Marrow subscriber. If you're one, you should use whatever Marrow has to offer you in terms of the lectures, and you should basically use them in a way so that your basic concepts of critical care is strengthened. And obviously I'm as a faculty, I'm very open to suggestions. If you feel that there's something that I need to improve, or there's something that you want to hear about, some topics that you think that has not been covered yet, I'm open to those, and I'll be covering those as well. But 75 plus hours of critical care lecture is going to be more than sufficient if you're able to cover all of those for you to. And along with that, if you do the MCQs, you're going to cover most of the critical care exams, not just like the NEET SS, INSS, any critical care exam that you set for, you're going to probably going to cover, probably if you have done it in depth. So that is all about, I think, all I had to say. And I wish you all the best for your preparation. And as I always say, may the force be with you. So that is all about it. I'll just close the screen sharing so that I can just have a look at whatever questions that you have. And then maybe I can just take some of the questions and try to answer them. Right. I think Dr. Maleshwar is asking, are the critical care videos same in the medicine group and the anesthesia group? Yes, I think they're the same. I think Dr. I think Yogesh can also
Yes,
course,
yes,
but essentially they're all the same videos.
yes, sir. Videos are updated in both courses at the same time.
Yeah, so they're the same. There's no bias or no discrepancy, because I'm the only person who's doing all the critical care recordings. So all the videos are the same, right? Are the current PG exam going batch eligible to write NEET SS in March 2025? That is very difficult for me to answer. You have to basically look at the notification, and you have to see what is the last date in terms of the eligibility. And you have to just basically check the notice. I cannot answer that, to be honest with you. I think Yogesh has said the extra basics are also covered in our pulmonology videos. I was personally not aware of that. And again, that is one of the biggest benefits of like subscribing to Marrow, with what I was telling you, that some things, if you just kind of search, you'll find a lot of things that maybe you have not found in a particular specialty. You might find somebody else from another specialty covering it in quite a bit of depth, and so that will kind of give you a lot of edge. And obviously, if it is already been covered in pulmonology videos, I would suggest that you watch it as well. I haven't watched it, but again, I told you about radiology masterclass, so that is also a good resource. But yes, obviously, if that has been covered in the pulmonology videos, then you can probably go ahead and give that as well. When we would get a hard copy of Marrow notes. So I think the thing with hard copy notes, personally, I feel is that, means like, I know a lot of people like to read off notes, but generally what I would suggest is that if you make your own notes, now that's going to be better in the long term, right? So that is something that you should also consider, rather than just depending on notes to clear the exam. Means that is my personal opinion, but obviously you should go ahead. I think Dr. Shubhradeep is asking, am I a Nalandite? Yes, I did my MBBS from, not MBBS, sorry, I did my schooling from Nalanda, from Nalanda in Calcutta. So if that is what you're asking. Hard copy of notes, I don't really know. So that is something that people have asked regularly. And somebody has suggested to optimize the Marrow question bank for CCM. So yes, that is something that I am like we are in trying to optimize. We're probably going to end up giving more question banks for critical care medicine. That is something that is going to probably come out in the next few months. But obviously that is a process in development. But obviously that is something that the suggestion that we're going to take. Where can we find previous year papers of INI or NEET SS? So I feel the previous year papers of NEET SS is not going to be that relevant now, right? Because the previous year NEET SS papers would be questions from medicine, and that's not going to be any more valid in the current scenario. But yes, INISS, I'm not sure whether there is some sort of a question bank that they have for specialty. You probably have to go and ask your friends. But I'm, at least when I was preparing, anyways, I was the first batch, so we didn't have any previous papers. But at least INISS, I don't think has that sort of question bank. There's something that you can probably, this would be recall based, right? And no publisher kind of brings out a book at the end of the year. So it's something that you have to probably consult your friends to find out previous papers. NEET SS past papers don't matter anymore, because they're going to be medicine questions. They're not going to be asked anymore at all, right? So what should be the approach now, as I think Dr. Gargi is asking, what should be the approach now as NEET SS now conducting only critical care papers separate? So I think the approach would be critical care based. That's what I told you in my bulk of my talk, that you should now focus on critical care, not worry about medicine, because what was happening for the last 2-3 years was that like even anesthesia residents who never studied medicine, like core medicine per se, they would have to go back and like study some medicine or do some medicine MCQs or watch medicine videos, and that was probably not a very good step as well, and that is no longer needed now. So you just go ahead and study critical care. No need to study medicine, because every question is going to be from core critical care, right? As someone who may have started recently for his critical care preparation, is it possible to crack NEET INI? Absolutely, it is possible, right? There's no reason for it to be not possible, because like INI exams, they happen twice a year, right? So there's always two chances with INI. NEET SS happens once a year, but again, depending on the time you have had, you should actually modify your preparation accordingly. If you have just less than 2 months in hand, and then if you're starting to just bring out a big textbook and starting to read it from scratch, you're going to not do well. So in those cases, just depend on the Marrow notes, do some MCQs, and just take a wild chance. You might get it, you might not get it. Even if you don't get it, then maybe next year or next time you can probably go for a more detailed division. So that your strategy that you have to modify depending on your circumstances, how much time you're able to devote to your preparation and how much time you have on your hand, right? So everybody would be having a separate challenge. How about adding some videos on clinical discussion, doctor, since it will help critical care medicines? Okay, I'll consider that, right? Because I still have a few more topics to cover in Marrow, though those are not the most important topics, some of the miscellaneous topics. So once I'm done with that, I'll probably add some clinical discussion videos as well, if that works for you. Dengue malaria like tropical infection was asked in current INISS. Okay. So what I'll do is that, so that is a good suggestion. Obviously, tropical illnesses and tropical fevers are very important, at least from our context. So I'll probably add one video for management of tropical illnesses from the ICU perspective. Maybe I'll add something like an approach to a fever that will kind of cover all the dengue, malaria, leptospira scrub, and all those other aspects as well. So I'll do that. HLH was not covered yet. HLH, again, it is not just core to critical care. That's probably going to be part of medicine as well. So I'm not sure whether medicine faculty has covered it or not. If it has been not, then these are things that, obviously, I'm not saying that there might be one or two topics here and there that might not have been covered, but trust me, that is not going to change your outcome, right? So that's the way you to look at it. If it has not been covered, I'm sure that's going to be covered in the next coming months, either by me or by some medicine faculty. Nobody can say how many questions will come from INISS from anesthesia and how many questions from CCM. Difficult to say, but the thing is that INISS is basically being conducted by the All Indian Institute of Medical Sciences in Delhi. And so it is the anesthesia department which conducts it, right? So they're not going to ask you, they're not going to ask you, what do we say? They're not going to ask you core anesthesia questions that, like, I'm an anesthetist myself, though I do not practice anesthesia anymore, but they're not going to ask you very much detailed questions in anesthesia. Even if they're going to ask you questions from anesthesia, those questions are going to be related to critical care, right? So if they're going to ask you about the use of muscle relaxant in, they're going to ask you about the use of muscle relaxant in ICU only, right? Like maybe for proning or for ARDS. They're not going to ask you about like some obscure stuff or how to reverse somebody if you have given something like rocuronium or Sugamadex or some stuff like that. Sir, I felt some topics are very, is a physics and monitoring part, cardio to oxygen. Sir, do you need this much just for NEET SS medical groups, or is it okay to study superficially? For medical, look, NEET SS medical group no longer there. It is now critical care. Again, the thing is that I have kept them in depth because of two reasons. Because there are a lot of people who do not know, do not understand the concepts behind it. And once you do not understand the concepts behind it, the later part of how to assess fluid responsiveness in the ICU and all those things become very difficult to answer, right? Or difficult to understand. So I've kept them in depth. Again, it's your choice, right? If you want to understand something in depth, you probably need to go through all of it. From an exam perspective, if you do not even understand it in depth, probably you're going to miss out on one question, right? You might not get one question right or two questions right. So again, these are the sort of strategies or sort of compromises that you end up making when you're preparing for a competitive exam, right? Because in a competitive exam, when you appear for the competitive exam, you do not know everything in depth. Even when I cleared the exam, I didn't know everything in depth. So there were topics that maybe I knew that very well. There were topics I didn't know that well. And There are topics I decided not to study because I kind of expected, okay, if the question comes from there, probably I'm not going to get it. But I tried to focus on my strengths. So those things are there, but I have given you the option so that if you're interested, you can go ahead and do it because those are very conceptual topics. So if you do not know, so other new videos, I think there's not really much left, to be honest with you. Major topic, 75 hours of critical care videos has already been covered. Ikka dukka jo hai, like somebody's told about tropical fever, and usually I'll be recording every week. So you'll be seeing 1 or 2 videos coming up every week. But don't worry about what one new video is coming or not. Focus on what is already there. Try to revise and try to this thing. When it is ideal to start preparing, whenever you have time, right? Whenever you have decided to take that leap or decided on taking critical care as a subspecialty or a super specialty, that is your time to start preparing. Personally, I was very interested in critical care when I was doing my residency, anesthesia residency. At that time, we didn't have DMs like AIMS didn't have DM. We only had FNBs in critical care. But even at that time, because I was interested in critical care, I was studying a lot of it. So there's no ideal time to start preparing. Please provide some test and discussion videos. Okay, we'll consider that. Is it essential to complete general medicine lectures for CCM exam? No longer necessary. Absolutely not. Will it be an exit level for DM? I don't know. Will it be an exit level for DM? I'm not sure about that question, to be honest. Can you provide a study plan and how many mock exams Marrow is planning to conduct in critical care? So that is something maybe Yogesh can provide you. Team Marrow will provide you in terms of what are the number of exams that they have planned, right?
Yes, sir. Sir, right now, I think we have scheduled one in December, and I think we will have two more before the NEET SS exam. And before that, we will also have subject tests, which are about 50 MCQs, which will try to cover the entire portion of the critical care, sir.
In terms of, I think Dr. Ishita is asking regarding before it was critical care anesthesia, so critical care questions might be borrowed from there. Look, I don't think that they're going to, like I told you, they're going to ask you, even if going to ask you anesthesia questions, those are going to be related to your critical care. They're not going to be like pure anesthesia questions. They're not going to ask you like something like what do I say? They're not going to ask you something like volatile anesthetics if it is not related to critical care. Even if they're going to ask you about volatile anesthetics, it might be related to things like using volatile anesthetics for like refractory status asthmaticus or stuff like that. So don't worry about anesthesia too much. Rather focus on the critical care part. Anyways, if you're an anesthetist, suppose your base specialty is anesthesia, and if they ask you something very detailed from anesthesia, if you have done anesthesia, you're probably going to get it anyways, right? Because your base knowledge is going to cover you. Suppose you're not from anesthesia, you're from medicine or you're from chest medicine. So focus on those parts of anesthesia or focus on those aspects that have some relevance in critical care. They're not going to ask you like in-depth anesthesia questions. In case they ask it, you're probably going to be at a disadvantage anyways because you have not done anesthesia as a specialty, right? So don't worry about those things. Don't worry about things that are not in your hands. Rather focus on things that are in your hands. Endocrine hematology emergencies, can you upload videos on that? Yeah, I'll do that because endocrine is covered by another specialty. So I thought that at least you have some, because if you have access to Marrow, you have some access to other specialties as well. So I kind of delayed that, but yes, that is something I'll add definitely. Hematology emergencies definitely I'll add because that is something that is unique to critical care. That is something that you're probably going to get in the next month. In the next 1 month, you're definitely going to get that video on hematological emergencies. For those appearing from medicine side, how much critical care medicine questions should we expect in exam? Like if you're appearing for critical care medicine, you would be expecting all questions from critical care medicine in the current situation. Even if critical care medicine is not very different from medicine, right? It is just the portion of medicine which kind of deals with a sicker group of patients. So your medicine knowledge will always help you, but at the same time, you need to have that extra knowledge that is relevant to critical care, right? So I cannot say how much questions you can expect from medicine side or how much from critical care medicine side, but generally everything is going to be critical care medicine. You won't be asked core. I don't expect you to be asked like core medicine questions, right? For new pattern, just doing Marrow CCM is enough, sir. Yes, it should. Yes, it should be enough. For MD anesthesia, should we watch medicine videos as MD anesthesia? No, it's not needed. Medicine, like previously, it was needed because previously all the questions were coming from medicine. Now all the questions from this year is going to be from critical care, so no need to watch medicine videos unless you want to want to know about a particular topic which maybe has not been covered in critical care and you want to just gain some knowledge about the topic. You have that option, right? But as such, it's not necessary. For clinical hematology, how we should approach clinical hematology, we do not need in critical care, but what we do need is hematological emergencies, as like somebody mentioned before. So I'm going to put on a video for that. How to approach infections, it's so volatile, and where to read antibiotics. Well, that again is like I do have some lectures on antibiotics in like this thing in Marrow, right? The thing with antibiotics is that I totally agree. Antibiotics is very volatile, and whatever we have read as antibiotics in our pharma, in MBBS, from KT party, it has no meaning when you are practicing critical care, right? Because in critical care we deal with a completely different set of antibiotics. I have put a few videos on antimicrobials which cover the more controversial aspects of antibiotics, right? So there's no point of me teaching you like what is a beta, like a cell wall inhibitor, beta lactams, what are the side effects. That is something that you need to know of yourself. If you want to know about advanced antibiotics, you can watch those videos. There are very good review articles as well. In terms of if you want to just kind of read, what I would suggest is not go and read from a textbook. Just search from a review article. Current Opinions in Critical Care is a very good journal that has some of those review articles. So those are some things I can suggest, consider. But again, antibiotics, I agree, is a volatile thing. That's why I've tried to cover the more controversial aspects in some of my videos. I'll probably add another video too in case you feel that there's something that is missing and you want me to cover. Marrow going to launch separate questions and test series plan only. I don't, Yogesh, is there a plan for a separate question and test series?
No, sir. It's a combined plan with videos, QBank, and test series. There's no separate plan for it.
Right. So that is not there. Post-surgical critical care, post-surgical critical care has already been covered. Okay. Post-surgical means like what post-surgical means? Abdominal surgeries are the main post-surgical, right? So there are no end to surgeries. But what is going to be asked is abdominal surgeries. So abdominal compartment syndrome and all those things have been asked. There are no end to surgeries per se. So obviously there's no neurosurgeries. Like every surgery is different. So there's no, maybe I'm going to cover something about necrotizing fasciitis and skin and soft tissue infections. But post-surgical critical care, the only things that you need to know, I would say, is one, abdominal surgeries, because they are the bulk of this thing. Maybe some thoracic surgeries as well. But again, I don't think that's going to be that relevant, to be honest with you. Thoracic surgery, the only thing that you need to know is that you need to give them less fluids. Because other than that, I don't think they're going to go ask you too much about this thing. Post-transplant critical care topics. Post-transplant critical care, again, I'm not too sure, because post-transplant critical care might be too detailed for this thing. They might ask you about liver transplant, maybe. Renal transplant, nobody nowadays asks, to be honest with you. But again, some of these topics, I don't think they're that relevant. Lung transplant, India barely does. I can put in a video, but again, I don't think that's really going to be very useful to you. Maybe we can do some of these rarer topics at the end when we have enough time, right? First, we should actually look at the major things. And post-surgical critical care, abdominal critical care is the main thing that matters in post-surgeries. Can you list a few colleges and hospitals for critical care, best colleges and hospitals for critical care medicine? Again, that is a very difficult question to answer, to be honest with you, because I have not gone through all the colleges, or I have not studied or worked in all the colleges and hospital. I myself graduated from Delhi AIMS. I would suggest is that if you are getting DM somewhere and it's not a paid seat, then you should take DM there. Yes. And if you're not getting DM somewhere, then you should look at the previous year's rankings. And that will actually give you an idea, because residents per se, they're very smart. And then there are multiple things to consider, right? You have to consider where you are staying, how far it is from your home. So maybe people want to stay in their own social circle and all those things are there. But generally, one way to go about is look at the previous year's rankings, and generally that will give you an idea. I cannot rank all colleges or all hospitals 1, 2, 3 in terms of what their good critical care training is. But again, if you do get a rank and you have maybe 2, 3 options where you are confused, maybe you can ping me on social media or LinkedIn, and then maybe I can give you a better answer. But right now, I cannot give you a ranking, to be honest with you. And finally, Dr. Farooq is asking regarding a little clarification regarding the NEET SS exam on 29th and 30th. I am an anesthetist. Is it possible to attempt from DM anesthesia group at DM session? Again, I don't know that, to be honest with you. I cannot answer your last question. That is something that you need to find out from the notification. I am not an expert in that. You have to find it out from the notification, to be honest with you. Whether you can attempt both, or what is the whether you are allowed to select one. Right. So I think that is all the questions that we have here. The previous NEET SS question was, I think, was based on this thing. And finally, I think Dr. Ankita is asking regarding, can you list important topics to start with? So go with the major things: respiratory, cardiovascular, GI, nephro, nutrition, cardiovascular, hemodynamic monitoring. These are the bulk, and then obviously the other topics as well. Again, depends on your this thing. Any WhatsApp group if created better for any doubts, sir? WhatsApp group, again, it's very difficult to actually keep track of things. But generally, if you have any, like, it's very difficult to me for me to answer like question to questions. But generally, if you have like any serious doubts regarding, you can just ping me on LinkedIn. I'm usually slightly more active on LinkedIn than on other social media, and I'll try to reply to the best of my abilities. Maybe it will be a lag time, but I'll try to definitely reply. So that is all about, I think, today's session. Thank you guys for joining. I hope it was useful to you. And um, do let me know if you have any other things. You can just ping me on LinkedIn, or you can ping Yogesh. And if you have any particular concerns, I'll just be trying to address in my future lectures and in my future videos. Thank you, guys.